Welcome to the Future Intelligence, the world in 2050 and beyond. We try here to make our way through the mass of the data that there is out there and make sense of out that what the future holds for us. And we bring together the best ideas, the best people, and trying along with our guests understand what future held. And I'm very happy to introduce my co-hosts, Dr. Tamas Landesz and Dr. Sangeeth Varghese. And I am incredibly honored to introduce Dr. Pavalkis, my dear friend and one of very few very intelligent people I know. And the funny thing about that is I asked him how to introduce him because he is so many things out of being a great, incredible doctor. And he said, I am many X's. So you could say ex-director of a huge university hospital, ex-onco-surgeon, ex-minister, ex-provost, ex-rector. But he is an oncology researcher who published more than 280 high-level publications and changed the landscape of oncology research in last 10 years, And he is expert for European Commission in many task forces. Thank you for accepting our invitation and welcome.
Okay. Happy.
So I'm gonna ask the first question, which is, what is the future according to you? How does it reveal itself, and what do you see? How do you see the differences between now and the future, like let's say 250, which is 30 years from now? And what do you think? What's gonna surprise us?
What you mean in what field? In treatment options, in the organization of healthcare, in the research field,
Okay.
or what more exactly you expect in 2050?
Our intention was to hear from you what was the first idea you thought about if we speak about the future, because you know so many levels. And what was the first idea? What was for you, oh my god, this future will be nice if? So we want to hear from you.
Okay. Okay. So I will try as usually to be a devil's advocate and to tease you uh, because I think future is very unclear in medicine, especially with artificial intelligence coming into the game. So probably it will change a lot of our activities we have now in education, in the diagnostics, in decision making, and I am not sure about responsibility, which is concerns much in United States. Probably everybody knows the history of the Da Vinci robotic system and why it is in bankruptcy now. Because there was this dispute between attorneys and lawyers, what is responsible for the mistakes made during the surgeon or robotic system itself. So they cannot decide that, and so they demolished a quite interesting and perspective system of Da Vinci. And robotic surgery is now under in the, how to say, low level to be. So I guess such discussions and responsibility matters will be very, very important in the 2050, if we say so. The second issue is without social interference, we could not be sure that artificial intelligence and pharma industry will not push us to the level of high spendings on the medicine and especially in oncology, as the prices are skyrocketing and effects are not evaluated as it should be. Probably NICE, it's National Institute of Clinical Excellence, and it is all the time under fire from the pharma because they are saying, oh, this drug is good, but it is not so effective to be included into the funding schemes. So it will be a huge, I guess, in this biopharma research changes with the time. And if to go back to education, what I'm coming from, my main, let's say, idea is, so I guess we will shorten educational things instead of 6 years plus 6 years of postgraduate training. Probably it will come to like 2 years of undergraduate education and 6 or 7 years of postgraduate, because what we are giving, anatomy knowledge, physiology knowledge, and so future doctors will not consider as a basic needed, and so on. So they will better will ask ChatGPT, what you would like me to do with this patient, and ChatGPT will answer. Look to the X-ray. We have the nodules here. Probably it is old standing tuberculosis, and here you can expect that, and here you can expect that. Check it. And so probably it will change our educational system in the future. Okay.
Thank you very much. I mean, it's very interesting because I just submitted to ASCO a paper on comparison of the decision making of oncology and ChatGPT, oncologist and the ChatGPT, and ChatGPT unfortunately won because we did that structured research. And we submitted that paper just some weeks ago. So the funny thing about that
Yeah.
is that if we would do that with COVID, because ChatGPT didn't knew COVID, that and the new strains and so on, that would not work. So ChatGPT can combine the information that we already know, but not generate new ones. The new ideas are generated
Not
by human
necessarily.
beings.
They are able to be trained, and I know clinical trials on the cancer screening programs with the low dosage of the computer tomography in the pulmonary cancer. So artificial intelligence algorithms are able to recognize more and more if they are getting feedback of what they thought it is and what was in reality. So this training course of the artificial intelligence will be very important in the future.
Well, coming from there, what do you think? What are the segments in education or in healthcare that are future proof, that we're gonna do for sure good in the future, and what are the risk segments that we need to address more
You mean with artificial intelligence?
with the old technology that we have, including
Karine, with
artificial
artificial.
intelligence?
All right. So I guess people understand that, and in European Commission and the calls for the funding, usually there is one question to the experts: does artificial intelligence algorithms were developed in the correct, precise, open style, and it will not cause any damage to the patients and in the future. So I guess it is very very important to understand that they can do, and the responsibility anyway will stay on the doctor who sign that, asking for advice of the artificial intelligence. So we will have a huge transition of the law system in the medicine, on the responsibility on the patient's protection and so on, to fully introduce artificial intelligence in the decision making, because and it will be highest how to say highest fight between developers of
Risk?
artificial intelligence, yeah, and doctors and lawyers, because we all know that the 2% probably of the healthcare budget out of the 20 in the United States are used by the lawyers in malpractice suits and claims and damage claims and so on and so on. So I guess they will get this opportunity additionally earn some money out of the healthcare system. Terrible.
Thank you. Terrible, but thank you. Tamas,
Yeah,
maybe
but
you can ask something that brings a little
it's
bit more
potential.
positive.
No,
Yeah.
positive.
So
I just want to make clear, it's a bad version of the prognosis, but I said I will uh, encourage you to say that it is not. And Thomas, please.
thank you, Dr. Pavalkis. So you mentioned that you have been having many very exceptional positions, and you have been an doing a lot of different having different responsibilities in the medical field, medical sciences, even as a minister. And I have been also an ex WHO IARC employee. That's the International Agency for Research on Cancer. So I can relate to what you were saying on cancer research. What I would like to discuss with you and hear your views is how do you think the doctors of tomorrow, of the future, we are talking about the 25-year horizon, will be different than the ones today? In that environment that you started describing with AI, with new technologies, how do you think the medical sciences will evolve, and what type of doctors of professions we need to work in that new environment?
Good question. Generally, I guess in 25 years, we will have the personnel who need to be quick in changes. It means such a specialties as a radiologist, pathomorphologist, and similar probably will be replaced by the artificial intelligence, because they see pictures better, they can analyze them, they can remember them, and so on and so on. And in generally, in total, not only in medicine, I guess it will be a situation that the people should be able to change their specialties, what they are doing, more quickly than they are doing now. Because if you got the specialty, let's say, I don't know, surgeon, yeah, so it's with a high probability the man will not change his specialty. He will stay in surgery until the he got emeritus status and go somewhere for consultancy. So maybe Karine is happy to have me here because I'm changed 3 times. My specialty being as my colleagues joked, most bloody surgeon in the field. So I got I got clinic of recurrent pelvic cancers. It means uterus, cervical, prostatic, rectal recurrent cancers were coming to my office to be operated. So with a high lethality, mortality, and a lot of blood in the OR. So, but after surgery, I by accident, in of course, became a minister, and not of the healthcare, minister of education and science. And so it was quite a new field, except of higher educational system. So vocational training, schools, and this level was totally unknown for me. And on top of that, I jumped into the presidency over European Council during my ministerial job. So all discussions and finalizing Horizon 2020. 2020, the signatures under this bill is mine. So we have a lot of international, not problems, but discussions together with Irish, together with Commission, together with European Parliament, with Mr. Ehler, with Maria Riera, Teresa Carvalho, and a lot of people were involved. So it was like coming from the OR to the international research policy making and so on. So I met a lot of important people, starting from the Emperor of Japan and ending with President of China. So, it was another field. And in the last my job, I came as a Central Asia specialist. So I spent now 5 years in Central Asia, in Kazakhstan and Uzbekistan, working in the university level, enjoying their system of everything. But it's another story. It will stay, and and now I'm in the research. I'm in research, applying for some and evaluating some research projects. So I can say that, answering directly to your question, that I guess the system of clinical trials will be changed. I guess, and it was discussion probably 10 years ago on the Capitol Hill in the United States, in Washington, about possibility to let the patient to choose innovative experimental drug without any permissions of FDA or EMA or somebody else. So it's his decision making. But of course, it was considered too dangerous and too many influence and will give social media funded by pharma and so on and so on. So this was stopped. But anyway, moving towards such a system will be realistic, and it's very it's very costly to do everything as it needed. as it is now organized, because it takes 10 years for one molecule to be approved. It's not less than 1 billion euro, and so on and so on. And especially it is concerns European situation, because there are too many regulations, too many restrictions, too many they are too many afraid about the disclosure of personal data, permissions, and so on and so on. So why is Europe is lagging behind all drug developers in United States and elsewhere in the world? So these issues will be addressed. How? I am not in position to say, but they will be raised and they will be decided.
Right. Well, that's very very thoughtful. Thank you for sharing that. So you're already yourself shaping the future in the present by being involved in all these um, ex- all these initiatives that you mentioned. Uh, but you're also involved in preparing the future generation. So what do you think? What type of skills they should be concentrating on that will make them most efficient in that new it's a new reality to come with all these new technologies, accelerated trials, as you said. Everything will be quicker, right? Hopefully, and will lead to better healthcare. Maybe even patients can do self-service. They use a ChatGPT to cure themselves, but doctors will still be needed most likely. So, what would be the skills you think of the future medical professionals that would be most important to prom today?
Uh, Thomas, I guess main it will be skill to challenge everything what was said and what is done, because they should not believe in anything. Future doctors, they should collect data from their patients, from their observations, from the, of course, from the literature, from the databases, from the recommendations, from the protocols. But if we are very strict in the protocols, it is not giving the best result of the treatment for the patients and for the society, because it's different. It could be influences on the protocol creation, and I was participating in these creations, and I can say they are not always clear and how to say transparent and so on. So we should and future doctors should admit that. So I guess, as you ask, that they should have the critical thinking and critical opinion on everything what the old guys like me are telling them. So they should try to quickly understand, to recharge, change, understand, adopt things in their everyday practice. And it means that they should be free to interfere with artificial intelligence, interfere with the National Institute of Health, United States, with PubMed, with everything. So it probably will remain some specialties like surgery, like obstetrics, like neurosurgery, in some extent, which are. I was joking that the medical education is best example in the world of the advanced vocational training. So medical universities were unhappy to hear that, but in fact it is, because if you will not give the student skills, practical skills, handy skills, his knowledge is zero. So it is corresponding very, very well that you are giving him theory and confirming, not confirming, but adding the skills which are making his understanding of the things much better than or theory or just skills alone. So such a combination is vocational training. Of course, it's on high level. It's not like in the secondary education. But in fact, I would like to stress that these skills will become more and more important in the future. Not theory, but the skills.
Thank you for that. I love it. Sangeeth, should we go further?
Thank you, Dr. Pavalkis. And so now I would like to shift the perspective a bit away from the healthcare conversation, which we have been having, and of course, which is your domain. So you've always also been a minister of education science, which is a very important responsibility. So I would like to know, from your experience as a leader of your nation, what is in store for your region as such, and especially for your nation, Lithuania, when it comes to 2050, when we are looking far away into the future, 25 years ahead into the future. As far as your region is concerned, what is in store? As far as Lithuania is concerned, what is in store?
Probably biggest concern is Russia. Because we are in the position having 400 kilometers of border with Kaliningrad Oblast, it's Russia and Belarus. So probably in the society now is the main concern is like this, not what the skills the school children will have, and because it protects. Not protects, it prevents us from good development because investments are afraid to come to Lithuania because of threat. The second, some more wealthy people are moving out to, let's say, some Spain, Portugal, making the investments here and buying the habitat for that in these countries. So we are in the shaky global policy situation. But if to talk about the internal affairs, I guess we are moving to the situation of the more free, not so restricted education system. So you can choose to do that or that or that. Generally, coming again to this critical understanding of everything and understanding what is happening, not what was said from the TV, but what in reality is happening is main concern for the educational society of Lithuania. On the other hand, educators like teachers, the majority of them are a little younger than me, but still majority are over the 50 years. So it means they are trained in the old system of education when this directive education was done. So you read this, you learn that, you learn these numbers, you make a control examinations, you write something, you do something. So in fact, is our future vision is to give more socially humanitarian and so education, why the our University of Education was joined with the General Comprehensive University of the Social Sciences, Humanities, Economics, and so on. And by this way, we are trying to make better teachers for our society. And our what is not quite happy with in Lithuania, it's coming very much of the private educational systems, private schools, which are collecting the best children into the schools. But the example of the Estonia and previously Finland, which were on the top of the educational systems, shows that if you take out of the class best one children and put them all in one class, best children's, they will benefit, let's say, 10%. But the class, what you take out of this good children, they go down on 25%. So helping the good children to get a little bit of benefit, you are leaving all the other system low back in the educational system. So it's on the one hand it's good, but it is making people to choose what they want. They are better tolerated, let's say. They are not maybe bullying nor and things like that. But for the system and for the country, it's bad.
Right. So you one of the things which especially attracted my attention is the socio-political tensions and the challenges which you're facing. And the second part which you mentioned was about the educational systems and how it is evolving. So, in the case of socio-political systems and in the case of education, of course, is there a way in which Lithuania specifically is preparing your systems to be future-proof?
I would say Lithuania is not the exclusion. We can talk about three Baltic states: Lithuania, Latvia, and Estonia, and we are in very similar situation. And before there was no like not military but paramilitary or patriotic training in Lithuania, because when we left the Soviet Union we said it's enough of this political things. But now when the war in the Ukraine started, in the schools again it's very popular, not patriotic, but preparing for the territorial defense. We have in Lithuania this problem that the number of the childrens are decreasing. Birth rate is not good, and we have to have some schools closed. So the concentration of the educational activities in the school sector is coming to the bigger cities, regional centers, and disappearing in the villages, periphery, and so on. So, is good or bad? I'm not now able to say. But probably it's better, because 10 years ago we did evaluation of the achievements in the state exams after school, and they were probably twice better of the children's coming from the bigger schools than coming from the smaller schools. So in Lithuania it works like this.
Thank you very much.
Ah.
That are very interesting insights from the school perspective too. Do you have an overall, let's say, 1-2 sentences for us how to prepare for future? for better future, please.
Usually I say just relax, enjoy life, have a good health, eat not too much, drink not too much, enjoy life not restricted way. So I guess we cannot do too much about the changing the logic course of the development in the world, but understanding that we can prepare ourselves and our students, our colleagues to accept what is coming. It's probably like Buddhistic philosophy a little bit, but in fact, we should understand what's happening, why it is happening, be critical in everything what is happening and what we listen in the social media, in public, and it's not matter. It's from United States or from European Union or from Russia or from Ukraine. You should be critical. So it's my final suggestion, and to be critical on everything what's happening.
Thank you very much for making this happen. Thank you that you have been an amazing guest for us. And we hope that the future is bright, the future is for better doctors, for better educators, for better education, and for those to learn and to understand from such a valuable knowledge that you have. Thank you for being with us, and thank you, my colleagues, for being here.